And if we have a successful insurance market that is affordable, low-cost, affordable insurance, and back to those 20-year-olds, you can buy insurance for a relatively cheap price if you fit that profile. But trying to have that mandate-light insurance to some is a risk if your true objective is universal coverage, all government-funded health care. And we've certainly encountered that debate in the General Assembly when we've talked about trying to deal with the uninsured. So the point is, if you really want to help the uninsured, and you know that many of the people who are uninsured actually are working and can afford it, then why shouldn't we be able to offer up a policy that meets their needs, not one that is high cost and loaded with mandates? And then lastly, I would say for those who believe in mandated insurance, we have a mandated insurance policy for automobile drivers. You all know that. And even though we have a mandated insurance policy requirement for all automobile drivers, I believe the percent is 10 or 12% of the drivers on the highways today are not carrying auto insurance. So we can talk about mandates all we want, but the reality is individuals will make choices for themselves. And those choices for themselves is, one, I don't want health care insurance. Two, I don't want auto insurance. For whatever reason, it's not me or you to make that judgment. They have made that judgment, despite what we think, what government may think, is in their self-interest. It is still freedom to choose in that extent. Now, what does it cost and who's going to pay? I observe for you that human services cost today in the Illinois budget exceeds the amount of money that we're spending on education. And that's a recent reversal. And I think that's problematic. I do believe that one of the incentives for increased health care is increased benefits. Again, back to this issue about not being able to control cost, not having any incentives to control cost, and a constant desire to increase the benefits that are available to the taxpayer-funded health care system. The incentives are all wrong. So when we talk about mandating universal service, health care for all, government provided for all, who's going to pay for it? And the issue that we're up against right now, or we saw this year, was the expectation that employers should pay for it all, that employers should assume billions of dollars of added expense to our government. And I would suggest to you two things. Number one, it would be, I think, terribly short-sighted for any state, our state or any other state, to go it alone in what is truly a national debate about health care. And when we impose significant cost upon employers, while our politicians might like to think that there are no economic consequences to those decisions, I would suggest to you there are huge economic consequences to those decisions. The bottom line cost of doing business in the state of Illinois versus the bottom line cost of doing business in any other state, in North America, or around the world. And we do not want to set up a situation where investors and employers, people with choice, people who control capital, make decisions about where to spend that capital. We do not want to set up an environment where someone in Dallas or Boston or Los Angeles or Atlanta simply says, why are we doing business in Illinois? I'm back to measuring dollars and cents. I'm back to measuring cost. The cost of doing business in Illinois is exceedingly high compared to doing the same business in another location, in part because in Illinois, the politicians think that business, employers, should cover all the cost of government. That our objective in Illinois is to shelter the individual taxpayer, the individual citizen, from the true cost of government by trying to shove that cost through the third party, the private sector, the employer community. And I suggest to you there are huge risks with that kind of philosophy. I would even go so far as to tell you I know for a fact, anecdotally, that last spring when our governor talked about a gross receipts tax that would generate about $8 billion being paid only by employers, that there were economic consequences. It put a chill on the Illinois economy because people began to ask themselves that fundamental question, and why am I doing business in Illinois? I know of companies who have consciously chosen to purchase land in Indiana and Missouri for the alternative that they can move if they need to. And if that GRT proposal would have gone through this past spring, I think we would have seen some of that action. So there are economic consequences to political decisions. Government-funded health care does not have a good track record for efficiency or cost controls, particularly here in Illinois. And it's difficult for public officials to restrain spending. It is difficult for elected officials to offer anything less than a Cadillac plan. I would suggest to you that much of what our public health care offerings are considerably better, if I use that term, than is being offered by private sector employers in many cases. And yet that cost is being borne by the private sector. It is challenging the private sector. This philosophy is challenging the private sector insurance and the private sector employer-provided health care. What appears to be underway is a steady campaign to constantly expand the public sector offering at the taxpayer's expense in an environment where no new taxes is the prevailing philosophy. And I don't know how we can accept billions of dollars of additional cost in an atmosphere of no new taxes to pay for those governmental costs that would in fact be embedded and would in fact be growing. It is neither realistic nor a sustainable solution. Now let me talk about some action steps. I think that first and foremost, before we talk about expanded government services, that our government needs to demonstrate greater accountability, greater efficiency, greater affordability for the existing taxpayer-financed programs. I believe that our government should, in fact, embrace managed care for its Medicaid recipients. And I believe, in fact, that our government should be engaged in trying to provide and incent healthier lifestyles for Medicaid recipients, just as employers try to engage and incent their employees to have healthier lifestyles. We must see, from our state government in particular, better cost controls for the billions of dollars that we are already spending in government, and I should use the term, I prefer the term, taxpayer dollars. We need to pay providers on time. We need to reward quality outcomes. That is, I believe that there should be some new judgment about who gets paid and who interacts in a government system, in the state government system in particular, based on outcomes, based on those four cornerstones that we talked about for private sector employers. Government, a huge payer, should be seeking and asking and expecting the same kinds of measurements and results, and be rewarding the same kinds of measurements and results. I think we should challenge some of the generous benefit programs that currently exist in the system, and quite frankly, we should talk about increasing co-pays, because the economics is what's going to cause many people to make the decisions to have a better lifestyle or change their lifestyle. Is as long as you think there's a free lunch, there's no incentive to take any steps to act any differently than you acted yesterday. And again, the idea that the private sector has already asked of their employees to assume higher co-pays or to accept the fact of the individual health savings account approach puts consumerism into the marketplace for health care. And I believe there are benefits to that, back to my fundamental point, and that is that each and every one of us is individually responsible for our own health and the health of our loved ones.